I'm Susie Kim. I'm one of the family doctors at Women's College Family Practice. We've been doing QI initiatives for probably 3 to 4 years now, and we've been collecting data methodically probably only for 1 to 2 years, and even then only using run charts for less than a year now. So in our practice, we have been using run charts probably for a good 4 to 5 projects. In general, we only use it to track information or measurements that we've been collecting over a period of time to see how they've been changing, and also to look at when we've done PDSA cycles, how have we moved those measures over time. So we're using them in a multitude of projects now, and generally we're just using them to see trends over a period of time. Because we're collecting data probably on a monthly basis, sometimes quarterly, we don't have that many data points yet. And in most cases, we're using a target that's maybe something that we've established through our AIM statement. And we're just seeing how we are in relation to achieving that target. So part of the challenge in creating run charts is taking the time to actually to analyze the data, to actually get the information you're collecting, plot it, sit down as a group and look at the information to see what we need to do next. And that has to be part of the system that you've created in terms of collecting the information. So the analysis has to be included in the process, otherwise there's no point in collecting the information at all. And I think the only way that we overcame this was by having one of our key team members basically being boss and telling us when to do what, and having meetings set ahead of schedule and having them already in place, so that we already knew that the date was looming and we knew that the data would be ready by that date and that we'd have to sit down and talk about it then. So being organized and having a systematic approach was very helpful for us. So I think in summary, run charts have been useful for us just to visually see how measures have changed over time, and also how our initiatives have moved these measures, as well as relaying the information to those around us, whether it's people within our team or people within our team in the broader sense, so within our family practice in general, and has been a very valuable communication tool.
Hi, my name's Nicole Bourgeois. I'm a dietitian and health promoter here at Women's College Hospital Family Practice. One of the initiatives that we have used a run chart for are around our immunization, improving our immunization rates. For example, we were looking at our pneumococcal vaccine rates in our patients who are over 65 years. And so we had pulled some data out of our electronic medical record to establish what our baseline rates were, and we had set ourselves an aim of achieving an 80% vaccination rate for this population. So how we used the run chart in this scenario was that we were able to plot at any given time, and we checked regularly, about monthly to begin with, to see what proportion of our patients were fully immunized. And as we conceptualized some changes to try out, we were able to plot them on that line. So what we could see over time was which changes were really helping to improve our rates and which changes were not. For example, we thought about having a standalone immunization clinic for patients in this target age range. We'd invite them in and see if they would come to get their vaccines. As it turns out, it did not improve our vaccination rates at all. But what we did find was that the use of a reminder within our electronic medical record to prompt anybody who was seeing the patient to offer the vaccine was more helpful. We were able to see more sustained changes over time, and that's something we did keep. For another initiative we were working on, we also decided to use a run chart. The project in general was to find ways of bringing in complex, high needs, high cost patients who didn't have a family doctor into our practice. And our goal was to get about 5 of these patients in per month at a steady rate, kind of standardize the process. What we found initially, though, is that we weren't actually meeting our target of 5 patients per month, which was surprising because there sounds like there's a lot of people who are out there in need of a family doctor. So what we did initially was to plot how many patients we were successfully attaching to our family practice. So we started off with one line on our run chart. And what we noticed is we were not meeting our targets every month. We weren't successfully getting those 5 patients attached. But we didn't know why. We didn't know, is it a problem with our referrals? Are we not getting enough referrals into the program? Or is it a problem more about bookings? Are we not able to connect with patients? Are they not coming in a time that's convenient to them? What was the actual problem? So our first line didn't tell us all that much. We had to add 2 additional lines. One line told us how many referrals are we getting each month, and the second line told us how many people are actually getting booked into the program. So it tells us a story a bit more of what we had started initially. It tells us a more complete picture. And so what we were able to learn from that is, A, we had to drum up some more business. We had to increase promotion of the program to let more people know. And once our referrals were higher, odds are we would get a few more people booked. We still had, some loss of patients to follow up. Some people would no-show, but we were able to increase our partnerships with different community organizations to ensure that we consistently had enough referrals to make the program successful. So I guess these are not really typical or traditional examples of run charts, but I guess at the end of the day, it's most important to be able to, as a team, look at the data in a way that's meaningful to your team so that you can identify trends and make decisions on the results.